Allie Morgan, physical therapist, craniosacral therapist, and Tellington TTouch practitioner for animals and people. And this is Tristan, who is a Corgi. And we're here for, I think, episode 34 of Conversations with a Corgi. And today I'd like to just share with you a few things I look for when I have a new person or a dog or cat or a horse coming for a TTouch evaluation. Now, I have many evaluatory skills and techniques that I use when assessing an animal on their first visit. But I thought today some of the things that we do in TTouch would be particularly interesting for you to look at your own pet, or if you do body work with animals, or even if you run a doggy daycare or a dog grooming shop, it might be useful just to know some of the things that we look for in my world when assessing a dog's health and wellness and balance. One of the first things I notice when a dog comes to me is how he walks. And so often we see dogs pacing, which means two legs on the same side go forward and then the other two legs on the other side go forward. This is a sign of many potential problems in a dog, particularly with their spine muscles and also muscles and joints in their legs. Pacing is not a normal gait for a dog. Some types of horses pace naturally, some of the gaited horses, but even so, every horse should have a 4-beat walk, as should every dog and cat. And if your animal does not do this, there are compensations going on that are coming from restrictions and pain in their body. It could be the first sign of Lyme disease. My sister and I noticed in my dogs when they later had DM early on in their lives that occasionally there would be a bit of a pace in their gait, which, being a very long dog, happens sometimes in a Corgi, a Basset Hound, or a Dachshund. But there were symptoms that we could detect just visually by looking at asymmetries in the gait very early on that indicated that the dog did not have a fully functioning nervous system and that was susceptible to DM. Now there is, in fact, a test for that you can mail some samples from your dog's saliva to the University of Missouri, and you can find out if your dog has the gene for DM, in which case you would really want to watch them closely for any signs of compromised gait, including pacing. So many dogs that come to me are pacing because of the kinds of harness or leashes or head collars that their people have put on them. And dogs that tend to pull lead to owners that are very frustrated trying to find a way to take that dog for a walk without having him pull on the leash. And those people tend to buy several harnesses from many different companies and listen to advice from lots of people. And some of the harnesses that are very popular now that attach just in the front, actually the leash slides around and pulls the dog out of balance, leading to this pacing gait. The long-term effects of that are profound and far-reaching and not good. Your dog can just start to have some restrictions in his spinal cord and in his musculature and a consistent asymmetry in his gait, which down the line, that impingements that are created in the spine from walking on an angle like that can actually decrease innervation and function in some of the organs in your dog. So if we want our dogs to live as long as they can, and we all do because we love them so much and their time with us is so short, please, please, please look at how you're using your leash and harness with your dog, and really don't use a collar to walk your dog at all unless you really have to, because it's so painful and restrictive on their neck and their vertebrae. And if they do get scared, they could get away, or if they tend to pull, they can do really permanent damage to the structures in their neck, the thyroid, the larynx, and some of the cervical vertebrae and the structures around there. So using a collar to walk a dog is not a good idea. Even a quiet dog can suddenly decide to chase a squirrel or be afraid of a car backfiring and pull at the leash and do damage to themselves with the collar. So many dogs that I see have been walked with a harness with just an attachment on the front, between the front legs. And a lot of times that harness doesn't fit well and the attachment slides around and the dog gets pulled off balance when they're walking, and they will come to me with a pacing gait. The other reason that we see pacing gaits is because of Sometimes they pace. I had a pug that was pacing because he had ruptured some discs in his back. He was a little bit too frisky with a pillow, a cat pillow that he had at his house, and he was humping the cat for hours, and that led to herniated discs in his back. And it was a stuffed cat, not a real one. And he eventually was starting to pace, and within a few days of him doing that, he had some x-rays, and we found out that he had some pretty significant damage in his discs from his activities. So pacing can indicate a number of things that are going on in the spine, and it's a really important tool in my assessment package for a basic evaluation of an animal that I'm seeing. This happens too in cats. I see cats that are pacing often because they have restrictions in their shoulders from jumping and landing a little wrong, or getting older, maybe a little arthritic. Sometimes a rescued cat has had something happen to him in the past that you're not aware of, and that leads to restrictions in the front end, which causes the cat to pace. One way that I assess the significance and depth of the pacing is using the TTouch Labyrinth, and I have a version of that here. It's this little maze at the bottom of the page here, and you just walk the dog, you can do this with a cat as well, around right angle corners and watch the hind end and see if the back legs are stepping 1, 2, 1, 2 around the corners, or if one's planted and the animal spins, or if the animal can't bring the outside one around and steps out of the labyrinth and then the other leg goes with it. So watching what's going on with the hind end on the corners is the second part of my assessment. After I see if the animal's pacing, I walk them in a right-angled corner and see how they use their hind end. If that back leg is spinning, the inside one, or if the outside leg is falling out of the corner, I know that that animal already has some restrictions in their low back, typically, or the thoracic lumbar junction, that are causing the pacing, or that were a result of the pacing gait. And using the labyrinth, people can go home and use wrapping paper rolls or broom handles or whatever you have in the house, ropes, and make a labyrinth and actually help their animal learn to walk without pacing after a treatment by using the labyrinth with them. It's a really important part of my assessment package and my evaluation and training tools to help an animal improve their gait, function, and balance. I'm going to work at a horse expo in a few weeks, which you'll hear more about later, in Connecticut. And I asked them to please have a labyrinth in the area where I'm working with the horse, because you can see so many things about how an animal moves and about their emotional balance even by walking them around the labyrinth carefully and observing what's happening. And many people think, oh, I can just walk my dog around a right corner. Yeah, that's fine. You can take your dog right now and walk him around a right corner in your house. However, if you do it too fast and don't give the animal time to think and see how he's balancing his body, they are usually just falling forward on their forehand and running around the corner, basically falling as they're going around that right-angled corner. And I've seen this many times with young, leggy dogs. Great Dane puppies are the perfect example. They have so much legs and not so much coordination yet, and when they go around a turn, they just sort of fall onto their forehand. So assessing the pacing of a dog is a really important thing I look at. The next thing, when the dog comes over, they usually will sit, and I notice which side they sit on. Are they sitting on the left cheek or the right cheek, or are they sitting straight? Dogs often have a reluctance to lay on the uninvolved side, meaning the side that's injured is the side they want to put towards the ground when they're either laying on their side, or did you find your stuffies? Or when they go to sit. So if you find your dog sitting with one cheek on the ground more often than the other, that means you might have a dysfunction happening there that needs some attention. And it's important to notice if your dog doesn't choose the same side all the time. Hi, Joan. Any particular harness you prefer for dogs? I have a Cavalier. Yes. Now, they're a little bit hard to get right now, but go to the TTouch website and order a harness from the office. They might have them in stock in your dog size. The TTouch harness, and we are going to do a whole talk about harnesses, and I'll show you some of them. It has two pieces that come around in the back here, and you can attach the leash here and here. It's similar to a Freedom harness, which is what I used to always recommend. And a Freedom harness may work for your dogs, but the TTouch harness is really good for trying not to restrict your dog's neck and head. And boy, walking a Cavalier, even one without SM, in a collar is a dangerous situation. They are so prone to problems in their neck and their head, so it's really important to use a harness with a Cavalier. And if you have a dog that pulls a little bit, really important to get a harness that fits properly. So we will be talking about harnesses. If I had a spare hand here, someone could run to my office and grab my TTouch harness, but I don't have it with me. So I will show you in a couple of days the different kinds of harnesses. It was a similar one, but it sets him scratching. Yeah, the Freedom harness actually is good because it has this velvet bottom half, which seems less irritating. Although on some Cavaliers, because of their silky fuzz, it can get tangled up in there. So I really like the TTouch harness. I know they have them in stock in the British office if they don't have them in the United States right now. And then you get one with a little Brit flag on it, and with a Cavalier, that's kind of a nice thing. So the harness can make a big difference. So the next thing, after I watch which cheek the dog sits on, I have the person walk them away and walk them back. And at this point, I'm looking for things like, do they have an even waddle in their butt? You know, is their left cheek and their right cheek waddling equally as they're walking? And then I also look for things like, are they walking with their head turned to the side? Are they limping up on one shoulder or the other? And a lot of the long dogs can walk in a straight line with their butt turned to one side. And this is a sure sign you've had a dog that has been walked on a leash in a not really effective way when they tend to walk sideways. I remember somebody at work who had a dog, and they said, oh, their dog always trotted sideways too. And it didn't even occur to them that they had taught their dog to trot sideways by using the wrong kind of harness and collar, and by the way they were walking him. He was a Labrador. There is no reason for that dog to be trotting sideways unless they've taught him to trot sideways. So I look at which cheek they're sitting on, I look at the symmetry of their gait when they're walking, and I also, when they're walking away from me and back, I see if I can notice any similarities or dissimilarities in the length of stride in their steps. Usually, if there's an injury or a problem, you will notice one leg not stepping as under the dog as much as another leg, or the front legs will not be taking as big a step as the other side. So usually, often that's hard to see. A small dog in particular, a Chihuahua, their steps are so tiny in the first place that you have to really have a trained eye to notice if your dog is taking even steps. But it's an important thing for you to teach yourself whether or not you can tell if your dog's taking even steps. With a Cavalier, for instance, they're going to have little fuzzy legs, and it's going to make it even harder to see if their stride length is the same. Sometimes I tell people to get a place where there's like kitchen tiles, and you can see how long one step is based on the lines on the floor. Or a little dog like that you can take in a bathroom even. Or just notice when you're walking on a place like the street where it's flat and level, or in your driveway, and see if you can notice any differences between the step length of each leg. So once I've assessed my dog's movement using these many techniques, oh, and I also look at the tail. I don't have a dog with a tail, so it's not always the first thing I think of. When they're walking, their tail should sway side to side symmetrically. If that's not happening, if the dog's holding the tail to one side, or if he is wagging it more to the left than the right, like this, you know, then I know there's something going on in his spine or in his hind end that I'm going to want to take a closer look at. So all of this is part of gait. Are they holding their head up or down? Are they, like one of the dogs I work with has a neck problem, so she holds her head this way all the time when she's walking. And of course it's obvious and easy to see that, and then I know that I need to work on her neck to help get rid of some of those restrictions. She has other physical things going on that make it so she has to hold her head that way, but it gets more and more turned over time if she weren't having that addressed by bringing coming to me for some treatment. So once I've looked at my dog's gait and his posture, I also notice his breathing. I stand next to the dog and take some deep breaths myself and try to time them with the dog's breathing. And I notice then if the dog is holding his breath. Now they're coming to my house usually, and it's a new place, and some dogs are really excited. So it's important to do this after they've settled down. They may be sitting on the floor looking at their person at this point, and just notice if the dog is holding their breath. Is their breath even? Are they kind of going when they breathe out, or is it a steady breath in and a steady breath out? I also notice, of course, with the smush nose breeds, the brachiocephalic breeds, boxers and bulldogs and pugs and Pekingese, are they snorting when they're breathing in and out? Because that will be an indication of some other things going on that I'm going to need to address with craniosacral therapy. And of course, many of those breeds, that is their normal way to breathe, but there are techniques that we can use to improve their ability to breathe. So I've now assessed their posture and their breathing. The next thing I'm going to do is careful observation. So I'm going to look at my dog's coat, and I don't know if you can see mine's very hairy coat. He had a bath, so now he's really shedding. Ugh. And I'm going to look at the hair. Stand up, Biss. Go ahead. Come on. Ugh. I'm going to try to look at the hair on my dog, and I don't know if you can see on him. I want to see if this line down the back is straight, the way their hair lays. Let's put you this way a little bit, Biss. There. So this line down the middle should be straight with an even split of some hair going right and left. Now, any place that doesn't happen, like on him, right back here, the hairs on this side are heading that way. He's got a little curl. He says, I'm embarrassed, Mom. He just had a bath, but I know that this is partially how he is. And I see many animals that have this little hair turn back here in the lumbar part of their spine, and it's usually an indication that there is a similar thing going on up in their neck. Whatever's happening in the low back is usually happening in the neck, and vice versa. So I just observe that and think, that means this side of the dog is going to be tight, and this side of the dog is going to be stretched in this area because he's got a little twist in his fascia right here, which I can see by his hair. And then I look down his spine, and an interesting thing about him lately, you need to see your buns, honey, is that in the last 3 months or so, he's got a little turn up here on the end. Not a carrot or a rutabaga, a turnip, but his hair turns up. And this is an interesting change for him. I've watched this over the years because, of course, I'm always walking behind him, and I see his little butt waddling when he's walking. And I think this is actually a good thing for him because it does indicate more mobility in his docked vertebrae. And I have seen him have a little bit more symmetrical and full waddle in his buns when he's walking. So I look and make sure that there's, the very last hairs on the dog. I know many labs, for instance, because they've got that oily coat, it's really easy to see. One side of their tail swirl on their going right and the other one should be going left, but sometimes they have different cowlicks in them, and that again indicates that there's an issue. A side with many cowlicks could be a tighter side. And again, the hair is developed from the same embryonic tissue as the central nervous system, and so butt cheek could indicate that he has some tension. We're back. Those two swirls on the cheek of your Labrador could indicate that your dog has some tension there in the muscles and the nervous system that could be coming from up in their spine. So looking at the swirls in the hair of a dog with a flatter coat like a Chihuahua or a Lab or a Boxer or a Pointer can also tell you about what's going on deeper inside of your dog's fascial system. The next thing I look at, and now you can look at the camera, Tris, is their ears. The ears should be at the same level. They should be not tense. They should have some movement in them, like he's pretty floppy there now. If the dog's ears are tense, sometimes they're just nervous. And I also see if you have one of those kinds of dogs where their ears come up and one's floppy and the other one's not, that's a sign that there's more tension in the fascial system on the floppy side of the dog, in his head, in his back, in his body. So I always make sure to take a minute to note which way the ear is flopping, and if the dog's ear sometimes goes up and down. I've known a dog who had several, including Boomer, the biggest dog I've ever worked with. He had huge, enormous ears, and one side kind of stuck up like a German Shepherd, and the other side sometimes flopped and sometimes stuck up. So I noticed at what point that floppy up and down side was going up and down, to notice how his posture and the way he was holding his body were, how that was working. With Tristan's ears, his ears are level, but I have a dog client now who actually has one ear kind of down like this. So I try to see if the ears are level, and certainly with TTouch, that means I'm going to do TTouch ear work and mouth work if I see ears that aren't level. And then really that's an opportunity for a really deep and important session of craniosacral therapy, because the ears are just an indication of what's going on deeper inside the skull and the brain and the fascial connections. So the ears are a very important part of my assessment. And that goes for horses and cats as well, because I have seen cats with unlevel ears or one bigger ear than the other. And then the other important thing to look at with your animal's face are their eyes. Are their eyes level? Is one eye bigger than the other? Is one eye more open than the other? The eyes can tell you a lot about what's going on with, again, the fascial system and the brain system inside of your dog. And I've seen many dogs that have assertive issues who have one squinty eye, which means that there's some problems going on in the falx or the tentorium in the middle of their brain. That is something we're going to address with craniosacral therapy. So it's really important to look at your dog's eyes and notice any asymmetries. Same with the mouth. Oh boy, I had a really big learning experience with a horse once. She had all kinds of issues going on in her hips and her neck, and I have dog hair in my mouth. What a surprise. And I hadn't really done a complete assessment, because it was really clear what was going on with her, and her rider had numerous issues. Well, a little bit into the session, I was working near her head, and I said, oh, her jaw feels a little interesting. And her owner said, oh yeah, let me show you her teeth. So she opened her mouth like this, and boy, her front teeth were all over the place. She had teeth going right, teeth going left. Her jaw was jutted out. She was missing teeth. Her jaw was such a complicated thing, and the woman had had her since birth, and the foal was born like this. And now we had a horse with a lot of behavior problems. She was very sensitive. She was tending to buck. She was lame behind, and it was all coming from restrictions going on in her jaw, which translated into her central nervous system. And this horse needed cranial work more than any animal I probably have ever seen, because the dog hair, because of her really specific issues that were manifesting from the jaw. Everything that's happening in the jaw is translated to the hips. And for this horse, your jaw is just a hinge, as I showed you in the ear work or the mouth work episode. It's just a hinge hanging off of your temporal bones. So anything that's going on in the jaw is coming from within the body for the most part, unless you get smacked in the jaw, which some horses have been. But her hips were so unlevel, and thank God her owner was a really responsible horsewoman, and really quite prominent in the horse community around here. And she knew better than to think about breeding this mare or selling her. She knew that she needed an experienced rider and that she would be unpredictable. And if I had met that horse when she was one, or even better when she was a foal, we would have been able to make some pretty significant changes that would have been quite beneficial to her. But the horse person, as do most horse people, don't know about craniosacral therapy, and very few people have the experience and skill to make a change with such a complex situation as that horse had. So it's not her fault for not finding anyone when the horse was a foal, and because of her prominence in my area and in the horse world in general, she is well educated now and has done some work letting people know about the benefits of craniosacral therapy for their horses. So with a dog, I just take a quick look inside their teeth and just see if any of the teeth are missing. If one of the front canines is shorter or broken off, that means the dog has had some sort of a situation. If Biscuit, you were falling off your pillows again. Come back. So the other thing I look at are the dog's paws, noticing if the toes are crossing, if they're spread evenly, or if some are tight together and the others are apart, because as I said, a lot of tension emotionally and physically can be held in the feet. You can learn a lot about an animal by looking at their paws. And in fact, one of the most interesting cats I've ever worked with, who had a bit of a stroke or a seizure, they weren't really sure, still not sure, but she's a happier kitty now. They recommended putting her down practically immediately when she was just adopted, and that cat's now been with that person like 10 years. But looking at her toes is quite interesting, because on the side that's a little bit slow to keep up with the other side, she has some toes that are like restricted together and the others are quite floppy. It's a really interesting mix of tension and relaxation in her paws. And kitty feet are pretty small, but it's really important to take a look at the paws. So those are some of the things I look for when I'm meeting a new client, just in a general way for a TTouch assessment. It does not mean that I'll necessarily use TTouch to address what I find. I may have to use orthopedic manipulation to address something going on in the spine. I may have to address toenail trimming if there's something going on with the paws. I can educate every owner in TTouch so that they can have some homework to do with their dog or their cat or their horse in order to keep the animal functioning at their very best and in their most balance after a session with me. And Bisky, do you have anything else to say about what we look for? He says he likes to see what kinds of treats people bring for their dogs, because sometimes they share really delicious treats with him. And sometimes he has to share his treats with the dogs that come here because they have no treats when they come. And treats are an important part of the work I do. Not necessarily as a reward, but sometimes when you're doing cranial work on the head, chewing can facilitate a release that's happening in a deep restriction. So yes, treats are an important part. So those are some of the things I look for: symmetry of the eyes and ears, the mouth, the teeth, symmetry and the step length in their gait, symmetry in the movement in their spine, the waddle of their butt and their chest when they're walking, especially with the big breeds like a bulldog or a French bulldog or a pug. Sometimes they'll have restrictions in their chest muscles, so it's important to watch them walking towards you, away from you, and beside you, so that you can assess all of these things. And I've had a lot of, because the sling muscles in the thoracic vertebrae that come down and hold the front chest of the dog or the horse or the cat together are under a lot of strain, it is really important to look at the gait from the front to see if they're winging and turning in, if the front legs are striding straight, if the chest is more developed on one side than the other. That would indicate some compensations that have been going on over time. Look at the wag of the tail, look at the hair. Any turns or twists in the hair that are asymmetrical or that are more on one side than the other. Places, in addition to that, if you have an animal that might have Cushing's, look at their stature. Are they have a chubby little pot belly? Do they have places where their hair is not as lustrous and shiny as in other places? And generally look at the coat and see if the animal's nutrition is at a good point. They should have shiny, silky hair, just like humans when they're healthy. So if your dog has dry, flaky, dandruffy coat, then you know that there's some issues going on. And sometimes that can be that they need an adjustment in their spine, or it could be a major overhaul in their diet more often than not. And certain breeds have tendencies to certain issues more than others. And then, as I said, we see how the dog is sitting. Is he sitting on one side or another? Does he tend to lay on one side more than another? And also, it's really important during the evaluation when I'm looking at all of this, I don't usually talk about it with the person, because it's really important, keeping in mind Linda's idea when you're working on an animal doing TTouch, to ask the cells to remember their potential for perfection. So I try not to focus on what is wrong with the dog or the cat or the horse when I'm doing an assessment, but just observe what's there. And it's like putting together pieces of a puzzle in my head more to know how can I help them than necessarily, oh, they have this, they have that. This makes a big difference in your outcome of treatment and also in your approach with the animal and how they respond. I also like to have the person take some time, instead of saying all the things that are wrong with the dog as well, and usually they'll say, well, he's been limping. I'll say, what's going on? He's been limping, he's chewing on one side, his ears this, is, whatever it is that they're bringing him for. And I let them say that. And then I ask them, what do they love about the dog? Or what made you choose this dog? Or tell me something about what he does that's wonderful. So that now we've shifted the focus of the evaluation to something positive and something that's beneficial about the dog and the person and the dog's relationship. And that will often correspond to a big shift in the body when I'm working on the animal. When people start talking about what they love about them or something wonderful that they've done or why they pick this dog at the shelter over the others. And it's really incredible to see the shift when you change the conversation to what is going on with the dog that they love instead of what is wrong with him. Tristan, he says, I have nothing wrong except that I need my treats and my squeakies. So these are some of the things I look for on an initial evaluation with a dog or a cat or a horse. And with a horse, there's many more details that I go into because they're so much bigger. I might even, with a dog, pick up each leg and try to do the TTouch leg circles like this, just to see if they go both ways evenly, and if both legs, both front legs or both back legs. See, he's really restricted on this side, but we knew that. He's got a shoulder problem. And he's also standing on pillows in the back, so when I ask him to stand on 3 legs, he's really got quite a balance challenge going on. And then if I do have more opportunities to see a dog for an ongoing basis, I will start to look at their balance by using some balance challenges, like having them stand on a pillow. That's the easiest thing to do. You don't have to buy expensive equipment. And anyone can do it at home to enhance their dog's balance and proprioception. So on a deeper evaluation, I would go and look at a lot of proprioception and balance issues with a dog, particularly a senior. And I'll also ask the person what they're feeding the dog and what kind of supplements they use, and bouts of Lyme disease up here, really important. Lyme disease is so common now. I actually see a dog occasionally who lives in the woods, a golden retriever, and he may have had Lyme disease for the last 12 years. His people have never tested him for Lyme disease, and it's because they don't want to treat him with antibiotics. And I said, geez, there's homeopathy and things you can use. They're not as effective, and it is far worse to have a poor animal living with Lyme disease for 10 years than it is to deal with whatever you have to do to treat it and to manage it. I just can't imagine in an environment like mine or at the beach or, down through the mid-Atlantic, having a dog and never testing them for Lyme disease, because there are so many, many ticks. We've already had 2 on his little tootsies when we were walking. Thank God he has white feet. When I come home, I always take a quick look at his paws, and often I can see a tiny little tick making their way up to snack on my Corgi. And that's when I know it's time to start spraying him with his cedar spray and some other herbal and natural sprays I use to repel ticks in my area, which are so effective. And we'll have more on that another time. So thanks for joining us today for Conversations with a Corgi. And I've talked about some of the things I look at when I'm meeting a dog for the first time for an evaluation, using some of the things we do in TTouch, including the right angle turns, body posture and symmetry, symmetry in gait, and symmetry in the way their faces and heads and ears are. So I would like to remind everyone to give your pet a hug or a snuggle or a walk. We finally have nice weather here, although at our usual walk time we are predicted to have storms of rain, which is fine. It's better than snow. And we will be back tomorrow at 8:25 for another episode of Conversations with a Corgi. And we will look more in depth at some of the inner workings of your dog. And I will see you tomorrow. Thanks for joining us. And sorry we keep getting kicked offline. They've been doing work all up and down my street with Comcast and Verizon for weeks. And I think that's why at around the same time in the morning, I keep losing my internet connection briefly. Hopefully it doesn't last too long and it hasn't interrupted the flow so much. So we will see you tomorrow.